Everyone, and welcome to our weekly briefing. I'm Commissioner Tracy Brown. I want to begin by just going through some housekeeping matters. This meeting is being streamed via Tippecanoe County's government's YouTube channel and also on Facebook Live at the Tippecanoe County Health Department's Facebook page. The media is joining us today at a remote location here in the building by GoToMeeting. And again, I want to thank Steve Klink, Max Walling, Paula Bennett, and Amanda Balser for their technical help on the stream today. And before we get into the press briefing, I want to introduce our panelists. We have Dr. Bean from IU Health with us again today, Mayor John Dennis to my left, Dr. Jeremy Adler, Mayor Tony Rosworski, and Dr. Wickett from Franciscan. So with that, I'll turn the presentation over to Dr. Adler.
Thank you, Commissioner Brown. Good afternoon. The format for today's press briefing will be similar to our previous two press briefings. I'll begin with some remarks on various topics. Then we'll have time for our panelists to make any comments if they'd like to, and then time for questions from the media and questions through our Facebook Live website. As of today, Tippecanoe County has 59 confirmed cases of COVID-19. We still have just 2 deaths in our county attributed to COVID-19. Locally, close to 3,000 tests for COVID-19 have been performed. The Indiana State Department of Health will begin collecting data on clinically diagnosed or presumptive positive COVID-19 cases in the near future. This will help round out our picture of just how much COVID-19 we have in our state, in our community, and will be very useful data for all of us in terms of our response and planning. The projected surge for Indiana is still predicted to be in early May, late April for Marion County, but early May for the rest of the state of Indiana. With this in mind, it is very important for all of us to stay the course. We need to be following Governor Holcomb's executive order and directives, instructing us to stay at home and to practice social distancing. These are the measures that are going to help us prevent our surge from being a large or massive surge. I know these measures are not easy. They are challenging for everybody, but these are the best weapons we have right now for protecting everybody in our community. So again, it's very important that we stay at home and only leave our homes for essential travel and essential activities. When we are out, we need to practice social distancing, maintaining a distance of 6 feet between ourselves and other people. We also need to avoid large crowds and practice strict hygiene measures. 2 weeks ago, the County Health Department released directives to essential businesses that were aimed at protecting the employees and customers of essential businesses. Those directives were primarily geared towards businesses that serve the public directly and have customers in their place of business. Today, the Health Department will be releasing additional directives that will apply to all essential businesses, and these directives are geared towards protecting employees of all essential businesses. The directives are consistent and in accordance with Governor Holcomb's executive orders, and they include measures such as businesses must comply with social distancing requirements established by the CDC, including maintaining 6-foot social distancing for employees, and they must modify their operations in the workplace environment to optimize social distancing. Businesses need to make hand sanitizer readily available for all employees and provide the means for frequent hand washing with soap and water for at least 20 seconds. They need to post signs reminding employees about social distancing requirements, hand hygiene, covering coughs or sneezes, regularly cleaning high-touch surfaces, and not shaking hands. Businesses also need to actively encourage sick employees to stay at home. They need to encourage frequently performed enhanced environmental cleaning of commonly touched surfaces and provide disposable wipes so that commonly used surfaces can be wiped down by employees. In addition, businesses shall screen employees for symptoms consistent with COVID-19 and exclude symptomatic employees from the workplace. They should also allow employees to work remotely from home when possible. Businesses need to modify their operations to prevent the formation of crowds both inside and outside of their business. Such modifications may include staggering breaks and lunch hours. Businesses should also minimize in-person meetings in favor of teleconferences or virtual meetings. Businesses need to minimize visitors in the workplace. Per CDC guidelines, businesses should encourage the use of cloth face masks by their employees in settings where social distancing may be difficult. So again, these measures are meant to help protect the employees of all of our essential businesses and operations. A topic that has been in the news a lot recently has been the reopening of our nation and of our state. We believe that the reopening of our community needs to be done in a slow and cautious manner, and the process should be driven by data. At this point, it is difficult to predict when it would begin in earnest and how it will unfold, since we haven't reached our surge yet. Two things that we can say the reopening process will require is increased testing capability and robust contact tracing. Testing will be necessary for symptomatic individuals and their trace contacts. And in addition, testing should be performed through sentinel surveillance sites, which would screen asymptomatic cases. The Indiana State Department of Health will be beginning a coronavirus surveillance sampling site test plan throughout the state of Indiana. These sites will be located in the various districts of the state, and their goal is to test a wide panel of asymptomatic individuals in our population, ages 12 and over, who have been selected and invited to participate. These individuals will have both blood and nasal swab tests done, and this will give us a better idea of how widespread coronavirus is in our state and in our particular districts within our state, and how much COVID-19 has impacted our state. The other element of reopening that I mentioned was contact tracing. And this process, which is already in place here in Tippecanoe County, will continue, and it will be a robust and meticulous process. The contact tracing procedures that the Tippecanoe County Health Department utilizes are very similar to the established procedures and protocols that our department has been using for many years to trace and investigate various infectious diseases. Our contact tracing program is currently administered by 3 public health nurses who are highly trained and highly experienced in performing contact tracing. The steps that they follow are when a positive case is identified, that case is contacted and information is gathered regarding the people that that individual has had contact with starting 48 hours prior to their onset of symptoms. Then those individuals who've been identified as close contacts are contacted and advised on appropriate quarantine procedures. The individual's employer is also contacted, and it is determined whether the individual worked any time during the infectious period starting from 48 hours prior to symptom onset. As you can imagine, sometimes it is difficult to contact everybody who has been in close contact for various reasons. The most common reason, though, that our nurses find is that individuals sometimes forget that they have had contact with a particular person. Therefore, if anyone feels that they have been in contact with a confirmed coronavirus case, they are instructed to call the COVID-19 hotline for further instructions. And our Tippecanoe County COVID hotline number is 765-423-9193. That hotline is open Monday through Friday from 8 to 4:30 p.m. One of the things that we hope to accomplish in our contact tracing program is if any of those individuals who are close contacts and are under quarantine do develop symptoms, we want to have a system in place where they can be tested quickly so we can find out if they also have COVID-19. Our process, as I mentioned, is robust and meticulous. If our nurses cannot get a hold of a close contact by telephone, they will either mail a certified letter or visit that person's home. I should also note that currently the Tippecanoe County Health Department does rely on employers to notify their staff if one of their employees has had a positive COVID-19 test. And finally, I wanted to announce that today we were informed of some good news here at the Health Department. We have been awarded an OKRA grant for $100,000. This grant will be used to provide supplies for persons that the Health Department puts into quarantine or isolation, and it will also be used to provide personal protective equipment for the Health Department staff who are involved in monitoring those individuals. That concludes my remarks. At this point, I'd like to invite any of our panelists to provide any additional comments.
Dr. Bean, start with you.
Sure. So I'll comment from the perspective of Chief Medical Officer at IU Health Arnett, and in response, I guess I'll make comments on the obvious topic of the day is the governor's half step forward in reducing restrictions on elective procedures. And I'll say that we're pleased to hear of that decision by the governor and are working closely with the Health Department and State Health Department to begin planning on how to do that safely with full focus on continuing to conserve our personal protective equipment and keeping patients and staff safe, being prepared for continuing to deal with the COVID-19 pandemic while allowing necessary but elective cases to start to be done again will take time for us to prepare for. And so I don't see this as being a rapid flip of the switch. It's going to be a number of days to weeks as we start to prioritize and plan for these changes amidst dealing with the continuing pandemic.
Thank you. Mm-hmm. Other comments?
Just real quickly, in addition to the governor's baby steps, I think that we also need to be acutely aware of the fact that as the weather improves, that doesn't mean that the health emergency has changed. People still need to remember that basketball courts are off limits. They need to remember that tennis courts are off limits. They need to remember that when they're utilizing trail systems and networks that they have to keep their social distancing. We have some tracks, specifically in the city of West Lafayette, where we've posted some signage to where they need to be acutely aware of their social distancing. But we are still under the umbrella of a health emergency, and we need to make sure that we continue to behave as such. In the environment, as the weather does improve, it's just intuitive to get out and do things. But as you do these things, please do them with the understanding that we still need to be careful about our spacing and our interaction with other folks.
Thank you.
I would just echo the comments. Nearly every day I get a text, a phone call, or an email from somebody who is asking the question about when are things going to be back to normal. And I'm quick to point out that normal, we can't predict if or when that is going to happen, but certainly I'm confident at some point in time we're going to see some positive changes, but I would encourage citizens to obviously stay the course that we're on right now. If you are a business owner that has been impacted and you have people that are away from work, I would strongly suggest that you start working immediately on what your recall process looks like and how you implement some of the things that are going to be coming down from both our local health department and the State Department of Health in terms of how you best protect those folks involved in your business. And again, we don't have a crystal ball. We don't have any idea of what the next press conference or the Friday, May 1st is going to look like when we hear from the governor on that day. But again, it's important to do what we in government have been doing all along, and that is preparing yourself for the eventual, I would call it a slow roll or a slow opening to normal operations. So be prepared.
I'll keep my comments brief today, just kind of three main points. First of all, thank you to all the citizens in our area, because I think overall we are still doing a very good job. And as I'm out and about, people are making an effort. And with each passing day, it appears that people are looking at the information, really wanting to understand the data, and I think that's important. So it's been a good educational process. So thank you to everyone and the efforts. We've started just initially at the City of Lafayette, talking with our communications and marketing department as some of these changes will slowly take place, about what our role is in helping keep the community informed, and also helping what we can do be done properly, and also ensure that we are making people feel comfortable. So we have started looking at us internally, what that would look like for us and what that would look like for us participating with the community as a whole. And so we have started the very early parts of those discussions, and I do think, as Tracy said, that's important that we begin to have those talks, because we might need to make sure that we are prepared to do things right and to follow the steps that are given to us. So again, thank you to everybody. Let's continue. We've made great progress. I think we have flattened our curve here in the community, and we need to make sure that we see this through to the end.
I'd like to express appreciation from the hospital community and the staff at the hospital for the support of the community. Good Friday was a Park and Pray event that went very well, demonstrating support. There was also an event where police, fire, emergency individuals went around the rings of both hospitals expressing their support. Multiple individuals in the community are at times donating food items to our staff, and certainly the staff do appreciate that. They do recognize that, and we are very thankful for the show of support from the community. This week we've also tried to pay attention to and communicate the element that both hospitals have worked very diligently and hard to prepare for a surge, and to separate and to have areas that would be separate in the hospital, and to encourage individuals, and we've seen this actually is occurring nationally, the element about the decreased number of emergency room visits, and people sometimes waiting who really require care, emergency care, waiting too long, or waiting longer than they should for that care. So we've really tried to encourage individuals. We've done a great job of being able to separate those individuals who have symptoms potentially that would be COVID positive from individuals that would not have. So the hospital is a safe place to come to if you need to for that appropriate care. Thirdly, we are working diligently and carefully in what does a restart look like. We really, over the past 4 to 6 weeks, have worked very diligently and hard at what does it look like to carefully and safely shut down some of our programs and to not do elective cases. And now we're in the process of, well, you just turn that back on. Well, you just do what you did in January. No, you don't do what you just did in January, because this is not January, and life is different now. So all the elements about what happens to a person when they walk through the doors, and all the changes in our processes as they walk in the doors, before the procedure, during the procedure, after the procedure. How do we make those changes, and how do we do that carefully and safely to protect patients and to protect our staff? And so that now is a new period of ramping back up of what that could look like and will look like, and will take some time. I know individuals are like, well, let's do it today. Well, there's more to it than just saying do it. It's How do we do it in changing processes, which are very, very important to protect everyone.
Thank you very much. If there are no further comments from the panel, I'll open the floor to questions from members of the media.
Dr. Adler, this is Jeff at WLR5. I was wondering about your latest, order, I guess, for businesses that you discussed at the top of your remarks. What is the enforcement for that going to look like?
Well, it's actually technically not a health officer's order. It's directives because these are things that are by and large required in Governor Holcomb's executive order. So they would be enforced through the same enforcement procedures laid out in Governor Holcomb's order, namely the Indiana Occupational Safety and Hazards Board would be the main enforcement agency, but also the enforcement can involve the Indiana State Department of Health, the local health department, and in some cases law enforcement or the prosecutor's office. So the enforcement would be similar to the existing enforcement procedures for other parts of Governor Holcomb's executive order.
It's Ron Wilkins from the Journal and Courier. Dr. Adler, you said that the State Board of Health is going to start changing the way it reports the cases to include clinical cases, and then there's some other details. Could you go over how they're going to change that, and will those numbers be reflected individually as in clinically diagnosed, or will it be rolled into the cases, the new cases? And, well, can you touch on that?
Sure. So the State Department of Health has an electronic system for collecting data on COVID-19 cases. It's the same system that's used to collect data on other communicable diseases. And currently, only confirmed COVID-19 cases were being reported to that system. The Indiana State Department of Health is going to change that to also allow for the reporting of clinically diagnosed COVID-19 cases or presumptive positive cases. So this would include individuals who perhaps have been tested, their test is negative, but the healthcare provider strongly feels that the test result is a false negative and that the individual actually does have COVID-19, so they would be a presumptive positive or a clinically diagnosed case. In addition, it could include cases where testing is either not feasible or deemed unnecessary by the healthcare provider, so that those individuals then would be counted as clinically diagnosed COVID-19 cases. And what the State Department of Health is trying to accomplish by doing this is really improve and get a better idea of exactly what is the true incidence of coronavirus COVID-19 in our state, and capture some of those other cases that would not have been captured before because they weren't a positive COVID-19 test result. So I think it's going to help us as a state really get a better handle on how much coronavirus is really in our state. What's the true incidence of this infection in our state? And another part of gathering more data to get a better idea of the true incidence is the surveillance testing that I mentioned that the State Department of Health will be setting up, where they are going to, in each district of the state, they are going to set up testing of asymptomatic individuals that have been randomly selected to get a wide selection of the population of people who are asymptomatic and test them for coronavirus and see if they carry the coronavirus or have evidence of previous infection. That will also give us a better idea of just how widespread the coronavirus truly is in our state.
Question from Facebook Live. Deanna, what is the medical tent at Christ United Methodist Church that says COVID-19 antibody testing? I didn't think there was a test approved.
Okay. I'm not specifically familiar with the tent at that particular location, but I am guessing that it is an antibody test that is being offered in our local area and in other parts around the state and around the country. And this antibody test does have several significant limitations to it. First, many of the antibody tests for coronavirus that are being promoted right now, and there are over 70 different companies marketing these tests currently. Of those companies marketing these tests, only 4 of them actually have FDA approval for their testing. So many of these tests have not been validated, and some of the potential drawbacks with this testing are the presence of or the possibility of false results, both false positive and false negative results. And that has led organizations like the National Academy of Sciences to say that the results of these tests should be viewed as suspect, and these tests are really a work in progress. And I think these sorts of tests will be fine-tuned and will be better. And as we understand more and more about the antibody response to coronavirus, these tests will, at some point, have a useful place in helping us respond to coronavirus in our particular area. Because of these limitations, the Tippecanoe County Health Department cautions individuals about relying solely on this test because of the possibility of false positive or false negative results. The antibody test is not currently endorsed or administered by the Tippecanoe County Health Department. I think that more work needs to be done on these tests, and more research and fine-tuning, more validation needs to be done before these tests can really be a part of our COVID-19 response.
Ron Wilkins again from the Journal and Courier. For clarification, the changing in the reporting to include the clinical diagnosed and the presumptive cases, will those be reported as along with and folded into the same figure of the confirmed cases, or will they be a separate metric?
My understanding is that they will be reported separately, so that when you look at the State Department of Health website where they have the daily updating cases, my understanding is that you'll see both the confirmed COVID-19 cases and then the clinically diagnosed cases listed separately.
And what is that likely to do to won't that cause a spike in the number of cases, or an apparent spike in the number of COVID cases in Indiana?
It could possibly. I'm not certain statewide how many clinically diagnosed cases there are currently, and I think that's one of the reasons why the State Department of Health wants to start collecting this data so that we have a better grasp on what the true incidence of COVID-19 is in our state.
Jordan Smith with the Purdue Exponent. What specific new protocols will the hospitals introduce in restarting elective procedures?
So I'll underline that what Dr. Wickert said a few minutes ago, that it's this question and this challenge that's being presented to the hospitals involves many different protocols. So how do you now bring relatively healthy individuals back into the hospital in a way that preserves and conserves our personal protective equipment, but in a way that's compassionate and allows them to be cared for and supported along their surgical journey. How do you do that now? That's different than we did it back in January because of the ongoing work with the epidemic. It may involve screening patients who are otherwise healthy coming in for an elective procedure now and doing a COVID test to assure that we understand their current health state even if they are asymptomatic. These are discussions that are happening now within hospitals, and that would be a new protocol, obviously, to follow. So
We'll have to keep a close eye on our PPE usage. So the daily, where are we at with PPE? How much is being used? How much is available? Will certainly be a criteria that we will have to put a new process in place. We also have looked at just what is the pathway for individuals who come in to the hospital? How do they get from the front door to where they need to be, and how do we make that as safe as possible? How do we put a mask on them, and what does that look like? And when they come in for pre-op testing, where do they go for that, and how do they do? So all of these are new process that we typically have done in the past, but now it's changed because we have to do it safer for the patient and for staff, and we really want to protect both. We want to protect our staff and we want to protect our patients.
I guess I'd add one other big area of work is in the past with elective procedures, they were scheduled based on the available operating room time and on when the surgeon was available. And now we're asking our physicians to start looking at the cases that they typically do, the procedures that they typically do, and further prioritize those to help us understand which ones now and when we have additional capacity for elective cases, which ones really need and will benefit most from going earlier in that queue. And so establishing a prioritization process is another new function of the way we are going to be working now.
Thank you.
Another question from Facebook Live. From Thea, do we have any data regarding nursing homes in the area?
So the nursing home population, of course, is an at-risk population, vulnerable population, and for that reason, of course, the local nursing homes have had visitor restrictions in place for well over a month now, and the staffs at all the nursing homes have been monitoring their patients very closely and have plans in place to test individuals in nursing homes who may have COVID-19. There's actually a strike team from the Indiana State Department of Health that will visit long-term care facilities and test residents of those facilities if necessary. And our nursing homes also have plans in place for isolating residents who do have COVID-19 and providing quarantine for the roommates or close contacts of those individuals. In terms of the local nursing home or long-term care facility incidents, we have been very fortunate in our community that we have not had an outbreak in any of our long-term care facilities like we've seen in other communities. And I think that's a testament to how well our long-term care facility owners and staffs have been working so hard to protect their vulnerable residents.
Excuse me, this is Jeff at WLFI. The question for Mayor Roswarski. Mayor, we've seen over the course of the last several days, West Lafayette freeing up some community development block grant funding for small businesses. What's taking place in the city of Lafayette to help shore up some small businesses who may, have difficulty tapping into those federal resources?
Yeah, we're going to be doing the same thing that West Lafayette is with that CDBG money. Our application will look just a little bit different than theirs. We're going to do some areas and a little bit different on the number of employees that a business can have to be eligible, but we're going to be doing basically the same thing. We should have that up and running by Friday or at the latest Monday for people to start applying. Obviously, we've got a very large area to look at, and we're having to put some parameters in there because there's not a lot of money probably in consideration of the need. We'll have around $400,000 that we'll be able to distribute. So we are working on the same thing. We got some final guidance from the Indianapolis office of HUD the other day that I think helped us out on exactly how we needed to frame some of this with it being an economic development. There's different ways you can frame what you're doing to be able to do some different things differently, and we wanted to make sure we got that just right to be able to help as many people and many businesses we can. So by this Friday or certainly by Monday, our application will be up online for small businesses to apply.
Thank you.
Question from Facebook Live from Jerry. What extra precautions are hospitals, clinics, and dentists making so as not to infect emergency patients who do not have COVID-19?
So we have, at Franciscan, we have created in separate areas in our emergency department. So individuals who would come in, who would say, I am suspicious or I have symptoms suggestive of COVID, are placed in a separate unit that's separate from the rest of the emergency room. We actually built separate walls and plexiglass so we can see through them. Separated areas, this is our COVID area or coronavirus area, and separated that from the rest of the emergency room. So individuals that come in with, I fell and I hurt my ankle, I hurt my arm, I hurt something else, or I have an abdominal pain, they would be separated from individuals who would potentially come in for symptoms suggestive of COVID virus.
Very similar changes in the emergency department. We're also having everybody put on a mask when they come in. And as you heard in the past two sessions, many practices have started seeing patients virtually and not having them come into their office at all. And so that's contributing to keeping people healthy and not commingling with people who may have symptoms. And then I'd say on the inpatient side, in the hospital setting, we are also cohorting our patients who do have COVID symptoms and are diagnosed with that concern on a specific unit. And so that patients who are in the hospital necessarily with other conditions are in other units.
And I'm not really able to speak to what dentist offices will be doing, but I can comment about what outpatient medical offices have been doing. At my own practice, the measures that we've taken, and I think these are very similar to what other outpatient medical practices have taken. We are, just as Dr. Bean alluded to, we are doing virtual or video conferencing visits, particularly with our elderly or vulnerable population, so that those individuals don't have to come to our offices. Within our office, we are separating the day into healthy patients and sick patients, so the two are not commingling or interacting with one another. All of our patients are being triaged by telephone before they even come to the office, so that we can identify people who may have symptoms consistent with COVID before they even arrive at our door. All of our patients are staying in their cars, and we are calling them on their cell phones when it's time for them to come in and taking them right to an examination room. That way people are not waiting in our waiting room. All of our staff and providers are wearing masks all day long. We have ramped up, of course, the cleaning of our high-touch surfaces within our exam rooms. All of our staff has daily temperature checks when they arrive at the office, so that we can quickly identify if any of our staff members have fevers. So taking these measures has really helped to keep everybody safe and helped us to continue to provide necessary medical services, but do it in a manner that is as safe as possible.
Question from Jordan Smith, Purdue exponent. Have the hospitals had to reduce hours for nurses or make layoffs because of the lack of elective procedures?
So we've had no layoffs at all. We've asked people, and they have admirably responded to be redistributed. So we have been having a significant effort to train our nurses and other staff who work in our physician office practices to come to the hospital and relearn for many some of the hospital care in case we would have a surge. So we've redeployed people, and we're retraining individuals in certain skills that we anticipate we might need more of in the future. But as of, we've not had, thankfully, I'm very grateful for the way the organization has been able to respond in keeping people secure in their positions.
We have done the same. We've had no layoffs, and we have redeployed people. So the other day, one of our nurses that work now in the operating room was on our intensive care unit. She's a former intensive care nurse, and she's like, yeah, I'm back in my old haunt now. I'm back in the area I used to be in. So we have redeployed people to different areas. The interesting part now is as we think about, as we contemplate, as we plan for this, quote, reopening, we're going to take people that have been redeployed and deploy them back to where they were originally and have to then get to work out, well, how do we do this from a staffing standpoint?
Thank you.
This is Emily Seibert from WBAA. We're talking about reopening right now, but how, I guess, across the board is everyone preparing for the possibility of entering into another shutdown period if there is an additional wave of cases in the future?
Well, obviously, we hope there isn't a second wave, but there's always that possibility, and I know that the CDC announced either yesterday or today that they're predicting a possible second wave occurring, and I would imagine that the steps we would take in a second wave would be very similar to the steps we're taking currently, only if we were able to identify the factors that led to a second wave. Of course, we would then be able to modify our response to that second wave so that we could hopefully prevent a third wave from occurring.
And from the government side, because we've gone through this once already, there's a lot of experienced folks out there now who have already been inconvenienced by the potential of this virus. Should there be a second wave, I think compliance would be much greater. And also, I think that the learning curve would be very, very flat because people are pretty well acclimated how to behave.
Are there other questions?
Facebook Live, Susie. Also, how are factories not providing masks and keeping employees 6 feet apart without offering protection?
Well, one of the things that we hope will happen as a result of the directives for essential businesses that we'll be releasing today is that that various employers, including factories, will really take a good look at their operations and modify their operations to optimize and promote social distancing, and will, of course, also modify their operations to promote hand hygiene and encourage the use of face masks, cloth face masks per the CDC recommendation in areas where social distancing may be difficult to maintain at all times.
Last question from Facebook Live from Thea. What will happen at urgent care facilities to keep non-COVID patients safe?
So similar to the answer I think that we gave earlier, we're screening all people who come in. Everybody who walks into our facilities now gets a mask, and we're assessing their symptoms very quickly and bringing them back to exam rooms. And
Yeah, the other components, I think, just trying to minimize the waiting rooms that we all were so used to.
Yeah.
Where you'd go in and you'd sit for an hour with 50 people. Well, that's not happening anymore. So you're waiting in your cars, you're being called in. So minimizing that, sitting in a waiting room with many, many other individuals, that's being eliminated.
Yeah.
Thank you. Are there any additional questions? No? Okay, well, thank you very much, everybody. We'll see you next week.
Thank you.